Today I welcome to the show Steve Smelski, and we're going to talk a little bit about the Jordan Smelski Foundation. So welcome, Steve.
Hello, Doc. How are you today?
I'm doing quite well. Today we want to talk a little bit about Amoeba, and I really want to get your personal story out to the community so that what happened to your son doesn't happen to somebody else. So tell me a little bit about what occurred.
In 2014, we decided to go to vacation in Costa Rica for the second time. We'd been in 2011, had a great trip. Jordan wanted to go back, and we'd asked him where he wanted to go for vacation. We went back to Costa Rica, stayed at the same resorts that we had in 2011. We had a full itinerary. We did zip lining, horseback riding. The next to last day, he and I spent 6 hours in a pool that had a water slide that had hot spring water in it. And Jordan went down the slide probably 200 times. Spent 6 hours, and the next day he had a headache. And we gave him some Motrin, and that seemed to be okay. The next day we went back to San Jose. We had a down day, and he didn't want to do anything. The headache was worse. We kind of laid around the room, got rested up, and we had a flight back on Friday. And we got home Friday night. He had an appetite, but the headache became worse on Friday night. Saturday, he seemed to be pretty good. He wanted to play some video games with one of his friends. And by afternoon, he just kind of laid around. He was kind of lethargic. We had dinner. He watched a movie. Saturday night, he began vomiting, and he couldn't keep anything down, and it lasted all night. Since we've been out of country, Shelley and I were like, well, if he's not better by morning, we're going to go to the emergency room. And we took him in Sunday morning. They did a spinal tap and a CT scan. The diagnosis came back as viral meningitis. They admitted him to the hospital. We spent the night with him on Sunday night. On Monday, he got up. He actually had a very good day. On Monday, we were joking around. We laid in the bed with him. He still couldn't keep anything down, but they had him on IVs. And then about 9 o'clock on Monday night, the headache became much worse, and they gave him some morphine for the pain, and he immediately began hallucinating. And that lasted 4.5 hours. And it was so bad, by the end, he didn't know who we were, he didn't know who he was, and he didn't know where he was. And he had a seizure, and just as he had the seizure, the ICU team had come in. They got him stable, they moved him to ICU. Jordan never came out of the coma. They lowered his body temperature. They were trying to keep him stable. He had cranial swelling, and we finally agreed to have them relieve the pressure late on Tuesday night, and they did a second sample of the CSF fluid and found the Amoeba naegleria fowleri. They contacted the CDC. They sent some medication down. It arrived 2 hours after Jordan passed away. So we found out late that he had contracted the Amoeba naegleria fowleri in the water from swimming. It had gone up his nose, entered his brain, and he passed away 7 days and 12 hours after swimming.
So, every time I hear the story, and I remember when I received the call that your child was in a hospital, and I often, on TV and radio talking about Amoeba, but I had never personally met somebody. And so when I heard that there was possible experimental drug being flown in, I thought, this child is going to have an opportunity. And then I realized within a few hours I got a call back and heard he passed away. So one of the logistical parts of this is that the medicine is not here. So talk to me a little bit about the efforts that you've been doing to get methotrexate here locally.
You're correct. It's been stored at the CDC in Atlanta. They have a 800 number that you can call 24/7, but most doctors don't do it. It's anywhere from a 10 to 18-hour process to contact them, do all the paperwork, get the drug flown in, especially if you're on the West Coast. It could take up to 18 hours. The problem with this infection, primary amoebic meningoencephalitis, every minute counts because it's actually destroying brain tissue as it multiplies and divides and keeps eating. And we've been working with the CDC and the drug manufacturer to try and get it where it can be stored locally at hospitals, especially in the high-risk states, which seem to be the lower belt, but there's been 2 cases in Minnesota, so it's a national issue.
So there's been a lot of discussion about how do we prep hospitals if they suspect viral meningitis. What are your recommendations in terms of what the hospital should actually ask the particular question?
That's a great question, because that's the one that nobody has addressed. We've worked with Dr. Raj Wadhawan with Florida Hospital, and they've moved to address their care pathways for patients. So they've now added an alert to the system. When a patient comes in, if they're diagnosed with either viral or bacterial meningitis, they immediately raises a flag and they start questioning whether they've actually been exposed to warm, fresh water. The amoeba lives in just warm, fresh water. It can live up to 121 degrees, and it can be active anywhere down into the mid-70s, thus the cases in Minnesota. So the key is to make sure that they start asking the questions and find out if there was exposure. If there's any suspicion at all, they should contact the CDC and have the drug flown in immediately.
And I know one of the questions that we constantly run across is this a rare disease? And me and you have had a conversation that it's probably more undiagnosed than unreported. And a lot of people believe it just pertains to children. But talk to me about your experiences in finding this in adults, and cases tend to pop up.
There have been a lot of cases in adults, so we've learned a lot since Jordan passed away as we've started to research what's been going on. We've talked to other families across the U.S. They've reached out to us, some of the most recent cases, asking, what should they do, how can they fight it, what to expect. What we've found is that we think it's much more prevalent. The median age is 11.5, but those are just the reported cases that we know. So the only way the reported cases are confirmed is if tissue samples are sent to the CDC and it's tested. If it's not actually a confirmed case, even though the timeline may match with others. What we've found is it's even attacked people as old as 69 years old. In Pakistan in the last 2 years, there's been 35 confirmed cases. One of the doctors from the CDC was from Pakistan. He would go home every summer on vacation, and he would teach the medical interns about Naegleria and PAM. And what they've been doing in 3 of the hospitals in Karachi is they've started looking for it. That public water supply is less than 50% chlorinated. In Muslim countries, they do ablution where they cleanse the sinus cavity several times a day. They've had 35 cases, and most of those were in their 20s and 30s, and it was men and women.
So this can occur in unchlorinated pools?
Absolutely.
Okay. So tell me briefly about the efforts the foundation is doing today.
So we've been working to try and get the drug localized at hospitals and not have it centered in Atlanta in the CDC. We've been working with the hospital systems to start educating the emergency room physicians and clinicians and lab technicians to look for it and what to look for. Now, it's very hard to find. So even if you do an autopsy and you know you're looking for it, it's hard to find. So our fear is many of the cases go either misdiagnosed or undiagnosed altogether. What we need to do is educate them on what to look for, the certain signs, and have the drug locally and start a regimen or a program for treatment for PAM. So if you go in now and you're diagnosed with viral meningitis, they'll give you antibiotics in case it's bacterial meningitis, and they'll find out 2 to 3 days later with the cultures if it was bacterial. So they start you on antibiotics. What we need to do is find out if there was warm, fresh water, also start them on a treatment case for PAM, because if you wait 2 days, it's too late and the patient's going to pass.
Yes. Well, I appreciate you taking the time to come on the show today and discuss this. I know it's still a struggle each and every day, and I want to thank you.